Everyone, this is Dr. Khan. So I have done 100% total capsulectomy en bloc fashion. I'm here at the hospital today on a Monday. This is a patient who is 56 years of age, has had a stent in 2012, and then 2013 another stent, cardiac stent in the heart. And then 2013, the latter part, she ended up getting an open heart surgery. So that's the reason why we're here at the hospital. She had implants initially from Dow Corning from 1990. They ruptured. And then in 2010, she had what was a replacement. So as you can see, she had grade 4 contracture on the right and also on the left. I removed some excess tissue at the bottom, which I found was abnormal. But I'm very happy and content with how the whole dissection went. And so these are her second set. I looked for any residual silicone. And I removed the entirety of the implant plus capsule. So as you will see, minimal blood loss, maybe 5 cc's each side, and as you will see right here, a dissection that went very well. We'll see what this shows, and the point here is to show that this lady was literally stressed out because of the pain that she had even at rest sleeping. This is an intact implant. As you can see, very thick capsule. I'm very happy and content with how the whole dissection went, and you can see how it's contracted inward. If I go like this, you can see how this is literally suffocating, compressing, grade 4 contraction. You can see it's a little bit on the yellow side, not like the clear gray ones. And so I'm very happy. If I put the implant here, you can see the line in the middle. This is your Allergan 475cc implant. And look at this on the inside. A capsule that's relatively thick. There are some calcifications. You can hear the snap that has formed right here. Calcifications that have formed. Complete removal of the entire implant capsule. Some areas thin. You can see my glove right here, but complete removal of the entire implant capsule. I'm going to go ahead and likewise over here on the left side. So she got the same surgery that a young patient in her 20s with no cardiac history. And there is no compromise in the en bloc given her presentation. Now what's interesting here is if you look at this. Look at this. This is a surprise to me. Look at this. Complete removal in the en bloc fashion. And this is a ruptured implant in a lady with heart surgery. And you can only imagine how this was stressing her heart out. Implants are not safe devices. And if I go like this, look. She was living with this ruptured implant, her second one, and you can see, look at this right here. All of this contained, this did not spill. Look at this. This did not spill under the chest, all contained in the en bloc fashion, and we can see on the inside, nothing out of the ordinary. Some areas very thin. You can see my blue glove. You can imagine it doesn't take much to cut into this. But again, the gold standard en bloc, so that none of this spills into the chest. Once it does, there is no way you can clean it, irrigate it. And this is precisely the reason why implants are bad. They are not safe devices. It's only a matter of time before they rupture, and this is apparently her second rupture. The gold standard, the en bloc, all contain everything within the system. None of this spills into the chest, especially on a patient with history of 2 previous stents and an open heart surgery. Done at the hospital in a very safe way, and you can only imagine how relaxed and how de-stressed she's going to be from a cardiac perspective. How many times we have heard those many patients who have palpitations, heart irregularities, and God only knows what she's going through. And again, we do not know the connection, but we clearly know that there are many patients who have gone to their cardiologist and gotten the workup with the echocardiogram, the Holter monitor, or the stress test, which is all negative, and the patient has these bizarre palpitations, irregular heartbeats, and then what they say, panic attack type of modes. And so implants are not safe devices. This was done very well. I'm very happy and pleased. Once again, the en bloc gold standard. Cultures taken for aerobic, anaerobic, and fungal. There was no abnormal fluid, so no fluid sent to cytology. The capsule will be sent 100% of the time to pathology to rule out the BIAL, CL, CD30 analysis, rule out the lymphoma, rule out the malignancy, rule out the squamous cell cancer, maybe rule out breast cancer, and there you have it. This is Dr. Khan, Executive Plastic Surgery.